Hello friends, this is VEMULA Kasinath. Today I want to talk about mobile game addiction and uh, video game addiction. First, I want to talk about video game addiction. Video game addiction is defined as a primary chronic disease characterized by imperial control, overuse, use of psychoactive substance and behavior. People who play games compulsively and avoid other responsibilities are video game addicts. Over 2 billion people play video games worldwide, and the market for video games is on track to become as 90 million industry in America by 2020. There are some games, video games, which are more addictive. Example, Players Unknown Battlegrounds, Free Fire, um, that's etc. What is mobile game addiction? Video game addiction is not an uh, uh, Video addiction is not an addiction that is recognized in the diagnostic and statistical manual of mental disorders. However, it shares many of the symptoms of the addictions and is a raising of honor. By seeing this picture, you can observe the truth about the game addiction. Just how harmless are our gaming habits? Will games really be dangerously addictive? Uh, Symptoms of video game addictions: playing video games for more than 3 hours per sitting, passive actives that are normally enjoyed, neglecting work to play the game, getting restless or irritable if you can play the game, trying unsuccessful to limit or stop game playing. Video games are so addictive. Effects of video game addiction. There are many effects of video game addiction. For example, obesity, physical appearance disorders, physical aggressions, depressions, obsessive compulsion disorder, abnormal social development, lower achievement. In this picture, you can see that. Can this be called an addiction? Having games all over, or just called be collectors? You know that they are in video game players. They will collect the video games. They're called are video game collectors. How to control video game addiction? Limit playing time. No playing in middle of the night. Homework and chores be completed first. Do not allow skipping classes or work obligation. Encourage alternative activities. Professional help may be needed. It's better to consult a doctor. Now I want to talk about mobile addiction. Who does it affect? Anyone. It will affect anyone. Most noticeable is younger age groups, students, teens, kids, young adults. Impact of frequent phone use: stress, anxiety, loss of sleep, vision problems, symptoms of depression, poor performance in school, relationship issue with friends, family, and a significant other. Impact in detail. Uh, when we are stressed on in uncomfortable situations, we can check our phones more frequently. We lose sleep, checking sites, watching videos, or testing others, waiting for a reply. Users experience anxiety symptoms if they are without their phones or waiting on a test. Statistics. According to statistics, students are reported an average of 94.6 minutes a day testing, 38.6 minutes on social networks, 26.9 minutes listening to music. According to statistics, women average 10 hours a day on their phones, men average 8 hours a day on their phones, college students in general average 9 hours on their phones. 60% of college students admit they may be addicted to their phones. How to take the precautions to prevent? We should limit ourselves, shut off our phones, have a friend or family member to hold on into it, take breaks, focus on objects that are further distances, anyway, every 15 minutes to reduce eye strain. These are the sources where uh, we can know about the video game and mobile game addiction. And thank you.